This is your 420 Radio News for Tuesday, April 16th, 2013. I'm Russ Belville. Governor signs Kansas drug test law for aid recipients from Seattle Post-Intelligencer. Governor Sam Brownback said Tuesday that a new law requiring applicants for a welfare program to submit to drug testing was a step toward ending a scourge on the state and break the cycle of poverty. The Republican governor signed the bill during a State House ceremony, saying that the state had an obligation to help residents break their addictions and improve their lives through treatment and jobs training. The bill would require the Department of Children and Family Services to screen individuals for illegal drug use when they apply for unemployment or temporary assistance to needy families. For anyone who tests positive for drugs, the state would provide mandatory drug treatment and job skills training funded by that program or Medicaid. The bill also covers residents who fail a pre-employment drug screening from being eligible for unemployment benefits. Applicants must submit to drug screening, and if they test positive, they would have to complete a treatment program and job skills training. Failure to complete treatment or jobs training would disqualify applicants from receiving unemployment benefits. Marijuana research funding cut as support for drug grows. This from Bloomberg. As more states embrace legalized marijuana, the drug's growing medicinal use has highlighted a disturbing fact for doctors. Scant research exists to support marijuana's health benefits. What's more, the federal government is scaling back its research funding. U.S. spending has dropped 31% since 2007, when it peaked at $131 million, according to the National Institutes of Health Research database. Last year, 235 projects received $91 million of public funds, according to NIH data. Fewer than 20 randomized controlled trials, the gold standard for clinical research, involving only about 300 patients, have been conducted on smoked marijuana over the last 35 years, according to the American Medical Association, the U.S.'s largest doctor group. Marijuana advocates point out inherent obstacles to conducting research. The National Institute on Drug Abuse controls all the cannabis used in approved trials, but the agency's mandate is to study abuse of drugs, not health benefits. NIDA also administered the most projects from 2003 to 2012, overseeing $713 million split among 1,837 research efforts. The bulk of the funding in the past decade was devoted to evaluating marijuana's risks, potential negative impacts on the brain, and developing prevention and treatment strategies, according to NIDA. Group of Illinois doctors backs medical marijuana legislation from CBS Chicago. Illinois lawmakers could vote on legislation to legalize medical marijuana this week, and a group of 250 doctors has urged them to support the measure. They said those who benefit from medical marijuana should be able to obtain it safely and legally. Marijuana Policy Project Director Dan Riffle said, unlike California, you're not going to be able to doctor shop. You're not going to be able to walk into an office, pay $100, and leave 5 minutes later with a recommendation, end quote. The sponsor, Representative Lou Lang, said his legislation would have the strictest regulations on medical marijuana of any of the states in America. Arkansas Attorney General rejects wording of medical marijuana plan from San Francisco Gate. Arkansas Attorney General Dustin McDaniel has again rejected the wording of a proposed initiated act that would legalize medical marijuana in the state. On Tuesday, McDaniel rejected the wording of the proposed initiated act by Arkansans for Compassionate Care, a group that campaigned for a similar medical marijuana initiative that narrowly failed in the November 2012 general election. McDaniel cited several ambiguities in the ballot measure. Medical marijuana passes New York Assembly Health Committee from Syracuse.com. A committee of New York lawmakers today approved legalizing marijuana production, sales, and use for medical needs. The 21-4 vote in the New York State Assembly Health Committee was not surprising in a chamber that has approved medical marijuana 3 times since 2008. Also added from HuffingtonPost.com, State Senator Diane Savino of Staten Island and Assemblyman Richard Gottfried of Manhattan. Both Democrats are holding a news conference today in Albany to promote the bill. Gottfried, who championed 3 medical marijuana bills that passed the Assembly in 2007, 2008, and 2012, but died in the Senate, said he believed this bill might be different. Polls by Quinnipiac University and Cornell University in 2010 showed that about 2/3 of New Yorkers favor allowing medical marijuana use. This has been your 420 Radio News for Tuesday, April 16th, 2013. I'm Russ Belville. When we come back, we go behind the headlines and take a look at two stories from Sacramento, California, showing that, as far as our prison and judicial system are concerned, growing pot is worse than raping a mentally and physically handicapped woman. This is the Russ Belville Show on 420radio.org. We'll be right back.